Hello and welcome to the Posture Dojo Podcast. My name is Sam Miller. I'm your host on this postural transformation journey, sharing some stories from my own healing journey of an 85-degree kyphosis and scoliosis, and speaking with experts from a variety of fields, some that you might expect and some that might surprise you. Today I'm very excited to have Ed Paget.
Paget.
I've never said your name, Paget. Yeah, I've never said your name out loud, but I've seen your name online for many years. I think you're one of the OGs when it comes to providing alternative treatment options for people to take control of their own postures and really start doing things. One of the big themes on our podcast here is re-empowering people, especially people who have spoken to traditional doctors or conventional medical offerings that really approach scoliosis and kyphosis with a very physical perspective, offering braces or surgery, and if you're lucky, maybe some type of non-invasive, maybe a Schroth specialized physiotherapist. But that's really the extent that the traditional system empowers people. So I'm excited to speak with you and dive into kind of what you've been doing for many years now in terms of helping people. Please describe how you approach this whole subject.
All right, well, thank you very much for having me on your show. It's interesting you call me an OG in this arena because the Schroth and some of the schools in Europe are hundreds of years old. I view myself as a newcomer, totally, but I appreciate
at least in the online space, right?
I think where I've been around for a while is on the online space. I've been doing this for 12 years online and I'm in practice for about 15 years, for sure. Yeah. So I'll just explain a little bit about what I do to your listeners. I'm an osteopath by training, and osteopathy is similar to physiotherapy or physical therapy in chiropractic. We tend to take a hands-on manual approach to treating illnesses and injuries and scoliosis. And when I was practicing in a clinic, I realized pretty quickly that the ones who did the best with scoliosis are the ones who did the exercises that I asked them to do. And I took some training down in the US with the Gray Institute, and they had a really unique way of viewing chain reaction biomechanics through the body, and they put that together of how they would manage a scoliosis. And I was in the audience listening to the presentation, and everyone was sort of switched off. Everyone really wasn't that interested because scoliosis it doesn't affect everybody, and it's not as exciting as working in a sort of high-end athletic sport and someone's got an acute neck injury or something like that. So I looked around and no one else was paying attention, but I was loving what these guys, the presenters, were saying. And so afterwards I said, hey, can I take what you just presented and just really run with it? And they said, yeah, it's not something that we specialize in, but it's something that we think our method could really help with. So I took what they did and I ended up becoming sort of the go-to person within the Gray Institute for scoliosis. And from that, these exercises were born, and the ones, like I said, the ones who did the best were the ones who did my exercises. And so I used to film a lot and make a lot of videos, and then I put them into a program that you follow sequentially. And after a while, I was like, I don't need to even see people. I just need them to screen themselves, make sure they're a fit for one of the four types that I work with, 4 types of scoliosis I work with, and they're good to go.
Amazing. So there's a couple themes I'd like to dive into on that. I mean, one being, how much results can somebody expect working remotely?
Yeah, that's a great question.
Compared to in person.
And results is something that people always want, right? So they want to reduce their curve. That's essentially what people do, and that's what you've done, and I commend you for that. However, I find it difficult for people to reduce their curve, or more difficult for people to reduce the curve the older they get. And the younger population seem to be quite well served. This is at least what I noticed in Canada where I was working, the UK to a certain degree, and then the US, is if you're between 9 years old and 14 years old and your scoliosis comes on, that's what they call an adolescent idiopathic scoliosis. And you will have a general practitioner, a pediatrician, an orthopedic surgeon potentially as part of your team, and they will monitor that. And if it goes beyond a certain degrees, they will offer you surgery. And that's the model. So to come in as a Schroth therapist or an outsider and say, hey, look, you don't need to go down that path. You can come down a more movement-based path. That's relatively new. Surgeons now are more open to that, but historically they weren't. And so we are seeing that with the right teenager, you can reduce scoliosis. And I've got some testimonials on my website. Just 3 months worth of exercises reduces curves by 20 degrees. So with the right person, at the right time, that can be done. Now, the older a person gets, they tend to have adolescent idiopathic scoliosis that they did nothing about when they were younger, or maybe they wore a brace or something like that. And now they find themselves in their 50s and 60s. And we know that in women, especially after menopause, scoliosis tends to progress 1 to 7 degrees a year, some papers say. And so they find that their rib hump might be getting worse, or their back pain is getting worse. And so now we're dealing with a curve that's progressing in adulthood, and we need to slow it down, stop it, or potentially reduce it. What I do is I help people go through those 3 phases. And so some posturally, they look 100% better once they've gone through the program. Others, we know we're slowing it down because it was a rapidly progressing curve. So it's very hard for me to say blanket terms what people will get when they do the program, but that's the aim, to slow down, stop, or regress. In adulthood and in teenagers, we're aiming to regress.
What limitations does the online environment, because as someone who's been teaching online for so long, obviously compliance, getting people to do the work is a big challenge.
100%.
And what is the limit? Are there limitations to online coaching for this, and what are those? Because I know you do some in-person things as well.
Yeah, I have a sort of a spectrum. So people can find me on YouTube, and there's free resources there, good to go. So those help people to get on the journey of movement as part of their therapy, or there's a phrase I like, which is called lifestyle is your medicine. So they take these exercises, put them into their lifestyle, and it becomes part of their medicine. And that's free, no entry, no barrier to entry. And then I have different courses. So some courses are to do with mobility. Some courses cover mobility, strength, and endurance, which are the 3 tenets of the program. And for people who say, look, I know me, I'm not going to do these exercises. I'll sign up to an online course and I'll never watch it. Then I work one-on-one online with people. And for them, people who are like, I really don't want to work online with you, can I come and see you? I actually do what I call scoliosis camps or scoliosis retreats in Central America. And so for me, the difference is if someone has a curve that's not a classic S-shape, reverse S-shape, C-shape, or reverse C-shape, then we need to alter the exercises slightly for that person. Or if they have something else in their health history. So let's say I have some patients who have MS. So that makes it harder for them to move, which means we have to change the way we do the exercises. But the exercises for those classic 4 curves are pretty good. You can't make many mistakes. And the reason is that I've taken it to almost as simple as it can be. In the movement world, we have in the movement scoliosis world, there's lots of different sort of approaches, but the big ones are the Stroth, which we mentioned before, and that is quite involved with a practitioner placing their hands on, using directional breathing and getting the person to feel nuances within the way they move. Then we have the Clear Institute out of the US, which involves more external devices, bands, chairs, traction, that kind of thing. And so I haven't done the course, so I can't speak with authority on it, but I think less internal control from the patient. And then we have things called like a side shift, which is part of the Big Seven schools. Side shift is out of the UK, and that's simply move your pelvis to the side, away from the side that it's shifted to, like simple, right? And so I would pitch my approach somewhere in between the Clear Institute and side shift. It's simple and not too complicated.
Interesting. So what are those 4 types that you're addressing?
The 4 types of curves. So the most common curve is a reverse S-shaped curve. And that means if you're looking at someone from behind, they are going to have 2 curves, one in the thorax, one in the lumbar. The thorax curve will have the apex on the right side, which is called a dextroscoliosis, or it will have and the lumbar curve will have the apex on the left side, which is called a lavoscoliosis. So for those of you who are watching, that's going to you're going to look like an S shape like this. And that covers about 80% of scoliosis. Then the other curves are the opposite of that, the mirror of that, which is a regular S shape. So you can draw a regular S shape on a person's back. So the upper curve will have the apex on the left and the lower curve will have the apex on the right. And then a C shape, reverse, and a regular C shape. And so they will have a longer curve, C shape on the left side will be the apex, and a reverse C shape, the apex will be on the right.
There's a lot to dive into here. And I'm also on this journey. When I started sharing my journey online, I realized there's a lot of people who need help. This is a very common kind of challenge for a lot of people. And a lot of people aren't as empowered because coming from that system. What would you say to me? I'm not a formally trained physician. I'm not coming from this world that you've come from. What advice would you give me on this mission to help empower people to understand that they do have the ability to learn how to sculpt their own bodies?
Yeah, that's a great question. So I divide my course into 7 steps. The first step is understanding. And we need to understand the scoliosis, we need to understand the progression of scoliosis, possible causes of scoliosis. And for idiopathic scoliosis, the word idiopathic simply means we don't know. But we can have a guess. There could be a genetic component, there could be an injury component, there could be a tight spinal cord component. For me, that's the most compelling reason at the moment that I've researched. We can come back to that if we need to. So education, understanding, that's step 1. Then step number 2 is understanding your own body. And so I get them to perform a whole host of self-tests. Does one foot move like the other foot? Because if you have a foot that's collapsed on one side, meaning the arch is down on one side, that will actually internally rotate the leg on the same side and drop the hip on the same side. Now, a dropped hip on one side might be the cause of the scoliosis because the pelvis is unbalanced, or it may be an adaptation to the scoliosis. We don't know. But it's important to understand all these imbalances within the body so that you can work on those whilst you work on your spine. Commonly, as people get older, they tend to pick up injuries or they have operations and things. So knee replacements, hip replacements, bunion surgery, all those things I find affect the way a person moves, which then affects their scoliosis. So we've got understanding, we've got self-assessment. And after we've done those 2 things, then we need to look at how the body moves with mobility and how the body moves with strength. Is it strong? And then how much endurance do you have? A common complaint in people when they get older with scoliosis is that they're just tired, they're fatigued, their back seems to not be able to hold them up for as long as it did when they were younger. So we need to increase endurance. And then, and to answer your question, we get to mindset. And I don't put mindset first because I think a lot of people think it's woo-woo. They want to, as soon as they buy a program, they want to get down on the floor and do some exercises or strengthen something. But I think mindset's very important. And so firstly, we have to understand that the body is not a mystical box. If you put an input into the body, it will change. If you lift a weight every day with one side and not the other side, your one side will get stronger. That's physiological fact. The bones will even get stronger over time. The tendons will get stronger. The ligaments will get stronger. Now, if you stretch that side as well, it's going to become more mobile and stronger. Again, physiological fact. So in order to change a scoliosis, you need to put an input into the body that's going to change it the way you want to change it. So if it's bent to one side, that's what we call the frontal plane. And there are 3 planes which we can talk about, but there's the frontal plane. Every day you need to put an input in your body that starts to straighten that up, either from the top of the spine down or from the bottom of the spine up. And over time, the bones will change, the ligaments will change, the tendons will change, and the muscles will change. And if it doesn't, then you're not of this earth. Put it that way.
I 100% agree with all of that, and I know that from my own experience, right? When you change your environment, your body will react to that, and obviously that's why your phrase lifestyle is medicine is the key. You're creating a daily lifestyle, a daily environment that will reflect your body into an optimal functional state. In order to do that, I would like to, you did mention the contraction of the spinal cord being something compelling to you. It's definitely gotten my attention because it's something that I hadn't really come across till about a year ago, where the studies that are out there, which haven't got the attention that they deserve. So I've been bringing it up quite a bit on this podcast. We have the original hypothesis in 1969 by Dr. Roth, who suggested asynchronous neuroosseous growth, the disproportionate growth of the spinal cord and the spinal column, the vertebrae. And then it was confirmed in some studies that there is a significant amount of people with adolescent idiopathic scoliosis who have contracted or shortened spinal cords. So how do you decipher these findings?
Not only that, it's a disproportionate amount of people with scoliosis have what they call a cerebellar tonsils, with their bottom part of their brainstem is pulled out through the little hole called the foramen magnum and is coming down to the top part of their neck. Arnold-Charcot malformation, we can call that, but it's more common in people with scoliosis. So what is pulling these people's brainstem out of the bottom of their brain? And this asynchronous growth, we can call it, I think is a very compelling reason. And one of the ways I think this works is that the nervous system doesn't like to be stretched or pulled or sort of messed with it anyway. And as the spine is growing, the nervous system doesn't want to be stretched as fast as the bones are growing. And so the brain can take pressure off the nervous system by keeping the spinal canal. The reason I'm pausing, I've just got a spine just behind me that I might be able to demonstrate this with easier. Should I do that? Yeah, okay, let me just grab it. Okay, so for those of you watching, I have a little spine in my hand. So behind here is the spinal canal where the spinal cord comes down. And you can see it's going to be stretched over this lump in the back here, and then there's going to be an arch in the lower back as well. It's going to be stretched in here, all right? So if we want to make the distance between the brain up here and its attachment way the way down here in the filament termini all the way down here, one way to do that is actually to rotate the spine so it lines up the spinal cord to be a little bit straighter. Another way is to actually flatten out the spinal cord to make it really straight. And in teens with scoliosis, I've noticed that they end up being quite erect and have a quite upright posture. And that's one of the reasons is that they're trying to shorten the distance from point A to point B. And then the third way is to say, okay, if it's rotating a little bit, if you side bend, because there's a coupling motion that happens in the spine, you've got side bending and rotation, that will actually line up the hole, the canal that all the way goes down here to make the distance here from here to here shorter. So it's a really clever way that the body just adapts to taking pressure off the nervous system. And that's why I think we can end up with scoliosis.
I agree profusely with this and want to bring so much attention to this because I feel it brings us closer to the root cause, and it's the genesis of what's it called, a genopathology, like the beginning of the issue. Because it's hard to go deeper than the nervous system. The nervous system with the spinal cord in the center when contracted. And I think about what makes a spinal cord and nervous system contract, and that may be a bracing, it may be a freezing, it may be protection from an emotion, from the physical environment, it might be the tension, it might be the anxiety, it might be a parasite. There's also that type of defensive contraction that may have happened because of that. But I think it brings us much closer to that cause, and when I see a lot of stretching and kind of aligning exercises online without the understanding that your brain is determining your breath and the either contracted or relaxed state of your nervous system, you're going to be you're attempting to align and correct in a contracted state, which is making it quite difficult. And so this understanding is so key, and it just blows my mind that it's not as common knowledge as it needs to be. But when you're able to relax the nervous system, you're actually allowing for that elongation and alignment to happen throughout the spine.
Yeah. I also see what you're saying. It wasn't quite how I understood it. I understood it as that the nervous system is just doing its thing, but the bones are growing faster than it can adapt to. And so therefore it's stretched. But I understand what you're saying. Maybe that's true. Or it could be a combination with a nervous system that is contracting against an osseous system that is growing. And then if we can find out what made the nervous system contract, then maybe we can help on a sort of very deep level. I understand where you're going with that.
Absolutely. And I've felt this in my own practice when I'm in these certain types of positions, when I'm able to not only bring awareness to my body, but then also bring awareness to the thought and the sensation that I'm experiencing, and then allow myself through my breath to reestablish a new state, a new sensation, to say, okay, I accept that, I surrender that to that, right? My version of pain is pay attention, integrate now, PAIN. So I integrate that, I allow that. I don't resist. I'm not like feeling it and resisting it. This is so painful. No, I'm like, okay, it is what it is. And now I'm going to send a new program. And I've said different things over the times, but I was in one particular position recently, getting into a deep, painful part of my hip obstruction that I had. And I said, I trust. And I felt that and I breathed that. And I immediately opened up and unraveled another layer and went and unraveled a layer deeper. So I'm starting to integrate this a lot into the movements that I'm doing, so that to take it beyond the physical into, okay, let's start bringing that awareness through the nervous system to allow this alignment that we're doing.
And that brings us back to the question of mindset, which I didn't fully answer. So you have embodied the empowerment of self-correction, we can call it. So you're confident when there's pain, that you integrate that pain into a new movement, and that's fantastic. And I think a lot of people don't. A lot of people are taught that pain is bad and that they should avoid it. And they also, unfortunately, believe what their doctor told them maybe 30, 40 years ago. These are for the adults that I work with, that there's nothing that can be done. You know, they went to the doctor when they were 16. It's not too bad to have surgery. There's nothing that can be done. And so they carried on regardless. But that thought of there's nothing that can be done, or to put another way, there's nothing you can do, is in their brain, deep in their subconscious. And for you and I to sort of turn up and say, well, actually, there is something you can do. You can move and you can do this. To their conscious brain, they understand it. They're like, oh yeah, okay, fair enough. If I stretch a little bit, I'll get more flexible. But their subconscious brain is saying, hey, that doctor who has way more authority in their life back then than we do, some person off the internet, that doctor said you cannot change. And so it's undoing a little bit of that programming that a person has from way back when, and from people who they may revere and authority figures. And that sometimes I find hard to reprogram. And again, in that step in the online course that I have, we go into that. We call it dealing with doubt. And it's when someone says, oh, there's no evidence for that. Or your doctor says, no, you can't do that. Or great aunt Fanny, who's had a scoliosis, says, no, I tried everything and nothing changed it. All those things feed into that subconscious brain and make it harder for the person to commit to a series of exercises which will change their spine given time.
I went through the conventional medical system about 20 years ago now, and I had fortunately grown up in an environment where there was a lot of these more holistic alternative ideas and healing therapies. At the time, they were very hippie and woo. They weren't accepted by the mainstream. Doctors weren't referring to anything in that region. It was still, we're talking like the year 2000 when it was very, really, let's say, science only focused, but now we're starting to see a bit more of a psychosomatic approach, that psychological as well as physical approach to it, which obviously integrates a lot of the stuff that was in these, let's say, alternative communities, but mixed in with a lot of. So I had been exposed to that stuff, and even I went into the doctor's office, and when it was like, you can't do surgery, there's not much you can do, enjoy your life. That was a program that I carried with me for 20 years until I couldn't carry it anymore, and I basically started experiencing the symptoms of being choked from the inside out. And so then there's that type of program that can be detrimental and get in the way of our own empowerment. But then let's go back to that contraction of the nervous system. And I guess my interpretation of what it means and why during the teenage years our nervous system and therefore spinal cord is contracting and potentially limiting the full elongated alignment of the osseous system. So around 12 or 13, I had a near drowning accident, a sprained kind of groin. And I believe that a lot of my kyphoscoliosis came from not the trauma of the strain, but the months of rehab, with no rehab afterwards, where I was really just bracing and protecting myself with that injury. And I believe it's that bracing that really contracted and just locked up my hips, which I always just thought, I'm just not flexible in the hips. But when I look back at that, I realized, wait, during those years when I was having rapid growth spurts, that my kyphoscoliosis appeared. And so it makes a lot of sense to me to really understand what could be causing that chronic contraction of the spinal cord throughout those formative teenage years, because I feel like it's one of the biggest potential ideas to address in this area?
You've picked a doozy though, because we know that if you have a leg length difference, a significant leg length difference over an inch or 2 or 3 to 5 centimeters, you're going to have some sort of lumbar scoliosis. So it's pretty obvious to say leg length difference causes scoliosis. Fair enough. We can all get on board with that. But then when it comes to these adolescents, we have to tease out something that's not necessarily mechanical, something that could have happened 5 years before, that could be a emotional trauma, could be a physical trauma, and then we have to correlate that with the scoliosis they have. But it's more common, 3 versus 5 times more common in females. So that's a clue. There's something happening there to do with potentially hormones or potentially genetics. And we know that there's something to do with genetics. But it's not just genetics, it's the epigenetics is what causes that, because not everyone with a family history of scoliosis ends up with scoliosis. So we can't say it is just genetics, and we can't say it is just hormones, and we can't say it is just leg length, and we can't say necessarily it is just an accident a trauma or an accident that the person had. Otherwise, I think, and maybe I'm naive here, but I think we would have figured that out, if that makes sense. We would know. But we don't know, and it needs someone to study from what you're saying, it needs someone to study the cases of the previous 5 years or so of each person with scoliosis to see if there is a correlation with something.
Yeah, that is a psychosomatic approach, and so going into psychology, it's less quantitative, right? It's less numbers, and I think that's why the system likes looking at the spine and the angles, because they can measure that and track that and say if there's a progression or it's stopped or it's improved. I think that's like a very clear kind of understanding that allows them to function at scale, which is ultimately what they're doing. And so when you go into the psychological, it gets a lot harder to scale.
It does. And then with that, let's say you retrospectively find something. Okay, yeah. Everybody had a trauma, physical trauma, which it involved some sort of shock, for example. So that could be stepping off a curb, spraining an ankle, but falling into the road and a car's coming. So there's shock and trauma. Okay, so retrospectively, you say you found this. Then you need to be able to prove that people who had a shock like that will get scoliosis. Does that make sense?
Yeah.
And
right.
So I know exactly where you're going with this. It's going to be hard. It's going to be a long road, and it's going to be hard to prove. But it would be interesting if someone does do it.
Yeah. And in the meantime, there are holistic methods that it seems you're integrating. I've integrated into techniques. I'm curious, what has your curiosity at the moment? Do you have everything you need to know, or are you constantly learning? And where's your curiosity taking you these days?
No, I do not have everything I need to know. That is no way. So I am constantly learning. It's it's what they call a habit, I guess. We can call it a habit. So as an osteopath, we have to do a certain amount of education every year, 30 hours thereabouts. And I sort of regularly top 120, 150 hours within that year just because I'm interested. And so within the field of scoliosis, I'm interested in how we can use nutrition to help people, how we can use mindset and meditation to help people. And this is mainly the adults who I deal with, because we're dealing with usually some sort of osteoporosis, we're dealing with some sort of inflammation. A lot of people have other comorbidities, diabetes, some with chronic fatigue syndrome, and so on. And so how can we step back and take a whole body, whole lifestyle approach to helping people with scoliosis? And so my program includes breathing meditations. I do a bit of the Wim Hof. I don't actively encourage people to do cold baths or cold showers, but it's in there if they want to. I do Qigong, which is a Chinese form of movement meditation for people who are meditation allergic, a little bit like myself. I like to be able to meditate but move at the same time. And we also bring in what I call sort of a lifestyle approach, where can we strengthen the whole body using what we call the spirals of muscular chains to help the scoliosis without necessarily being specific to scoliosis. One group in the Czech Republic called Spiral Stabilization have really taken that and run with it, and I've trained with them and I use aspects of their course in my program as well. yeah, I try and get as a whole body mindset approach as possible, as well as getting focused in on the actual corrections to scoliosis.
Yeah, I've used the analogy of a slinky before, and when you get a little kink or a bend in the slinky, it gets very hard to readapt, right? And we do have to kind of look at the spine and the body as a spiral. So walk us through the spiral dynamics that we could be aware of in our bodies.
Good question. So at the back of my mind is this idea that the spinal cord is shortened, and I feel as though it's probably shortened on everybody with scoliosis. If it isn't, it doesn't really matter. That's good for that person. But if it is, what we need to do is gently stretch the spinal cord. And so we know that stretching nerves is not easy. Nerves do not like to be stretched. And repair on nerves is slow. It takes about 1 month to repair a millimeter of nerve damage. That's if it's not severed.
And when we say stretching a nerve, my understanding, as it's an extension of literally the brain, the stretching is the range of motion for a muscle or a tendon. In like the range of motion equivalent for a nerve is relaxation and contraction, and that's happening through signals from the brain. Is that accurate?
Yeah, no, I don't really see it like that. I see it like the nerves are almost like cables in the body, that they don't really contract themselves. As far as I know, they don't have any contractile ability. So the nerves come down from the brain through the spinal canal, and they branch out either side through the spine, and they end up going to wherever they innervate, be that the skin or the muscles and so on. So the classic is what we call the sciatic nerve, right? That's a combination of nerves from the lumbar spine. They come together and they form a thick, it's about as thick as your thumb, sort of a thick tube that comes down up on the butt and then down the back of the leg. So when you're lying down on your back and you lift your leg up, that will stretch your hamstring muscles, but also stretches the sciatic nerve. And you can imagine that the nerve itself, it doesn't have this ability to sort of lengthen. So what it does is it pulls the whole nervous system from your foot up into the back of your leg, into the back of your thigh, into your butt, into your lower back. It pulls it all just a little bit. It's sort of anchored at the foot. And if that nervous system is stuck anywhere, from a little tight little tunnel somewhere or a muscle that's a bit too tight, that's going to become an anchor point. And so we need to, And
on that anchor point, is that potentially, the nerve itself isn't physically contracting, but it seems it's sending signals of contraction. And if we have a brain that's sending chronic, very regular, very frequent, almost permanent signals of contract, I imagine at those endpoints of that cable system, you're going to experience contraction all over the place. And that seems to be what these movements are addressing. And so you're referring to them as anchor points.
Exactly. So the nerve, the brain will feel the stretch on the nerve. It will send a signal out saying we don't like this, but it can't contract the nerve. It can only contract the muscles around the nerve. So it will make tension within the muscular system to protect the nerve. And so we need to then move the bones and ligaments and muscles in a way that doesn't trigger this reflex from the nervous system to contract the muscles. And so we do that by high repetition, low load movements that should be, where possible, pain-free. So for example, if I was to simply just drop my chin to my chest, that actually stretches the spinal cord all the way down my spine and come back up. And I flex and I extend, and I flex and I extend, not just once, but hundreds and hundreds of times. Because over time, that sends the signal to the brain and says, actually, no damage is happening here. It's okay to flex a little bit. It's okay to move. And we may, over months, get a lengthening of the physical spinal cord. And so we can take that movement further. We can say, okay, the furthest point from the brain is the foot. So if we were to take your leg up like a sort of like a karate kick type thing, I don't actually do this, but I'm just saying this is one way to do it. To swing your leg forwards and backwards, for example, will gently stretch the hamstrings, the sciatic nerve, and so on. And if you do it just below that point of just below there, over time, your brain will say, this isn't a threat, no problems, and lengthen off the muscles and the nerves as well.
And I've found we can encourage that feeling of safety. We can choose that feeling, and having that awareness and integrating it, especially in the exhale. I've found that 8-second exhale, really extending the exhale with that new program of safety. This is fine. We can actually start becoming sending the right signals through that nervous system. So we're providing it the somatic, physical feedback to respond to, right? We're talking about the body becomes the reflection of their environment, so we're physically changing in the environment, so our body's adapting to it physically. And then we're also integrating that thought, that belief, that feeling from the mind as well.
Yeah, that slow exhale puts the body into a state of sympathetic calm, essentially. And it's something that they've done in yoga for years, right? So in yoga, you breathe through it. You breathe through it. Childbirth, you breathe through it. And there's something in that. There's something in that. If you breathe out slowly and on purpose, it's basically a signal to your subconscious that says, you know what, we're not in trouble right now. This is fine. And it will reset or try and reset the nervous system to be more parasympathetic, which is the rest and repair. So if you can breathe slowly whilst doing exercises that are on the edge of your sort of comfort zone, it's going to retrain the way your brain perceives those exercises. So you're 100% right. That's the way to do it. Use the breath.
And going into these new ways of moving the body, it's amazing how much connection from the pelvis to the jaw, and then also the angle of the back of the head and the eyes, from the occipital to the eyes, in these positions. How important are these other things going on in our bodies?
Yeah, that's a good question. So there are different schools of therapies that focus on different things, and some would say, like the angle is important, the way you're looking is important. So if you imagine, let's step back slightly. I like to think about the way we've evolved as human beings. And so if you're looking at something that's very close to you and close up like this, that can cause you, especially when you get old and you can't focus on it, that can cause you a little bit of a pullback reflex, right? And you're just sort of moving your head backwards, and a slight rise in your heart rate. And so there's a mid sort of field, maybe 2-3 foot away, where you can look at something and you're nice and relaxed, okay? That is mainly to do with the way we've evolved. If we're looking at something close to us, we're generally relaxed and we're happy. If we're looking at something super close to our faces, either we're in trouble or we're in a situation we don't want to be in. But conversely, if you're scanning the horizon, you're looking too far out, that can actually be a way to increase your sympathetic nervous system, because back in the day, our ears would have pricked up, our eyesight would have looked out, and we're like, what was that? Was there movement? Is someone coming? Is something coming? And so it can actually be a stimulus to the sympathetic nervous system. Having said that, if you're looking at a sunset, it's the light's changing and so on, and that's a signal to our body to actually start calming down. And so there's lots of different nuances to increasing our nervous system, the sympathetic, or decreasing the parasympathetic. I'm not an expert in any one of these things, but I think sometimes what happens is that a school of physical therapy or school of chiropractic, school of osteopathy gets very excited about this one avenue, but then they tend to throw out a little bit of the baby with the bathwater about everything else to do with the body. Yes, it's important, but I don't know how important it is to override other things when we're dealing with the whole body.
I'm impressed by the knowledge and the depth of what you're talking about here, because correct me if I'm wrong, but do you not have a scoliosis? You went into this from the professional perspective.
Yeah, I did. I don't have a scoliosis. I haven't worked on myself, but I have my quick backstory I'll tell you is I was a reasonable rugby player back in the past, and then got into triathlons. And I ended up going to a show for triathlons, and there was a therapist there who was like, oh, I can help people get better. Like, he's a performance therapist. And I was like, great. So I went to go and see him. He took an x-ray of my back, and he put it up on the wall, and he put another x-ray up on the wall of a perfect spine. And he said, you seem like a smart kid. I just graduated my first university. And he said, you tell me the difference between your spine and this spine. And I was like, oh, that looks different. He said, yeah, that's a spondylolisthesis, which is a slippage of one vertebra on the other. It potentially could have been a break back in the day. And I was like, oh, doesn't sound good. And I said, that looks different. He's, yeah, that's facet atrophy. You've got a problem with the facets. And we just went through my whole spine. He just ripped it to pieces. I didn't have any pain, by the way. I was functioning very well. And then he said, you better basically just give me your credit card and sign up 3 times a month, and we'll see if we can stop you from injuring yourself in the future. And I was young and naive, and I was like, sure, okay, fine, whatever. I want to keep going at this triathlon business. And then I ended up getting back pain. And I was like, hey, I've got back pain. Can you help me with my back pain? Because that's what you're meant to do. And it didn't really help. So someone said, you need to go and see an osteopath. So I was like, okay, fine. I want to go and see this osteopath. Bearing in mind, I've seen this other guy 3 times a week for like months. And I saw this osteopath, and I was getting ready for a triathlon. And he said, how far away is the triathlon? I'm like, it's 2 weeks' time. It's 2 weeks. Okay, you better come twice. And I was like, that's it? Twice? And he's like, yeah, come twice. So I pulled out my x-ray, and I said, what do you think of my x-ray? And he was like, I used to play rugby as a kid. I'm like, yeah. And he goes, yeah, it's normal. Just toss it away. And I was like, normal? And he's like, yeah, nothing on there that's that remarkable. And I was like, come on, what about this and this? And he said, no, these are all just things that happen to our backs as we develop and we grow and we play rugby and we run into things or whatever. Don't worry about it. Anyway, 2 weeks later, I was good to go for the triathlon, and I literally signed up maybe 4 weeks later to osteopathy school, and I never looked back.
There you go. Okay. So you've been through different perspectives, and now you're developing your own, and I think you've put together a very holistic approach. Yeah, especially because I have seen a level of depth in people who are treating this, who have it themselves, but I'm seeing like through your obsession and your curiosity in this, that you've done that as well. So that's a really great achievement. I commend you for all of the work that you're doing and all of the information that you've put out there, because I do agree the biggest obstacle or the biggest thing getting in the way of a lot of people's quality of life is the belief that they can do something about it.
Exactly. Yeah, totally agree.
So let's close with, I guess, what is your belief that people can do, depending on age, maybe as you know, we know as time goes on, it's obviously more and more difficult, but what are some realistic expectations and perhaps some things that they do need to accept and integrate, whether it is that consistency or that discipline to do the work, or making it a lifestyle that you enjoy so it doesn't even feel like work? What are the things that people need to believe that there's hope, and then to actually get the results that they're after?
Mm-hmm. That's a great question. So let's talk about adults in this case. I feel that most adults left to their own devices will get worse. That's just the way gravity works. It pushes our head down, and we're upright beings in the field of gravity. And so if they're not actively doing something to counteract gravity, be it working out, swimming, something to do with strengthening muscles of their back, or what we call the posterior chain, which is the chain of muscles all the way down the back, that's more than likely to happen. So one, they need to understand that gravity will win. Number two, they also need to understand that if they do something about it, they can either slow down, stop, or potentially even reverse that progression. Now, how they do that is up to them. But I think the more specific the exercises are for their particular type of scoliosis, the better it will be. Then I also believe that people need to take a lifestyle approach. If they are not eating well, we know that can cause all sorts of problems, especially with osteoporosis and so on, or sarcopenia, which is muscle wastage, if they're not eating enough protein, which is a big problem. Then we need to look at how they're exercising the rest of their body. The older they get, we do lose muscle, and we need to basically play a game where we need to retain as much muscle rather than lose it, because it's harder to put it on the older you get. And then we need to look at their daily habits, because it's all very well for me saying, okay, you need to exercise and do this and this and this, but the oldest living people in the world do not go to the gym. And that's important to understand. The oldest living people in the world have a lifestyle that allows them to move optimally. And so that can be cutting wood or gardening or just walking to the grocery store. So looking at the way we move in our modern day, and actually saying no to some of the appliances of convenience, and saying, okay, I actually need to physically move this body in order for it to serve me the older I get.
Are there any fields or techniques or methods that you see coming through the pipeline? Obviously, there's a lot of advancement going on in different areas. Are there any that you're keeping an eye on and excited about in terms of what you're doing?
Yeah, from a surgical point of view, there's this thing called spinal tethering that I'm very interested in. And that is minimally invasive compared to having spinal rods put in and spinal fusion. Spinal tethering is a way where they would take a strap, put it onto the long side of the curve here, and it will stop this side from growing anymore and allow the other side to continue growing and hopefully straighten the person up. I think that's a really nice
kind of
advance.
Scaffolding.
It's like a scaffolding, yeah, but it's like a strap scaffolding. I think that's a really nice advance in surgery. And I think there are some interesting things which I'm trying to investigate more, to do with electrical devices that can stimulate certain areas of the back There's some research out of Boston Veterans Hospital. They have a small device that has apparently shown some great results in studies on people with scoliosis that simply run up and down the spine and creates different muscle stimuluses, which can help correct a scoliosis. But they're kind of hard to research, hard to find out about, and very expensive to buy. So it's something that I'm looking at.
Yeah, I mean, I've seen the orthopedic soles that generate a frequency. Obviously, in the Clear Institute, they have the chairs. I'm actually jerry-rigging one at the moment with a vibrational plate and basically a head traction device. If you were going to create your own electrical stimulation advice, where would you place it on the body to activate the muscles that should be activated, let's say as we're standing or walking? I mean, that's the idea, that we're creating this functional posture, right? So where would you place it on the body? And I ask that because many people with scoliosis and kyphosis, with these compensations comes a lack of needing the correct muscles, or let's say our default or neutral muscles, and different muscles activate. And that happens so chronically, that the other muscles we lose that neuromuscular connection and they go to sleep. So it sounds like the theory behind this is that these electrical stimulations are activating the places that we want to activate. Where would you place it on the body?
Good question. I mean, would I do the same thing with my exercises? So I'm just using exercise to stimulate the muscles and so
exactly.
on. So it's common that the long side of the curve here gets stretched and it's rotated. And so a lot of people think that this is actually thicker and more muscular. But most of the time it's not. It's actually just the vertebrae underneath rotating and pushing the muscles back, and their muscles are actually stretched and weakened. So I would put it on the long side of the curve to try and get a contraction through these muscles so that they can start to straighten up the spine. I feel like the inside of the curve, these might be over-contracted and need to be stretched. And so I wouldn't put it on the inside, I would put it on the outside of the curve. But that's just theory on that one. But for exercises, that's my approach.
Interesting. Yeah. Okay. Yeah, definitely wearable tech is something I'm very fascinated by as well. I think we have a lot of opportunities here, and I think as we have more understanding and more of a movement of people tapping into that ability to be able to understand that, yes, we have range of motion in our muscles, but we also have range of tension and relaxation in our nervous system, and we can actually do a lot more than we might have been told when it comes to correcting this. So please run us through what offerings you have online and where can they get in contact with you?
Yeah, so the hub for me is my website, which is edpaget.com. But I'm also on Instagram at ed.paget.com. And then YouTube, I have a whole host of videos on YouTube, which is YouTube at edwardpaget.com. Sorry, Edward Paget. And you'll find a playlist on YouTube that has lots of different exercises for the main 4 types of curves. And if someone wants to work with me after seeing some of these videos, these free videos, they like the approach, they can start with a very simple course, which I call the Scoliosis Symmetry Method, which is stretching exercises for the 4 types of curves. And then if they want to get more into it, I have the Scoliosis Correction Protocol, which includes the whole body assessment. It's actually a series of back exercises called the Back Pain Correction Protocol, strength, endurance, mobility, and lifestyle as well. That's my whole flagship program. And that, again, is self-led, it's online. And then if someone wants to work with me personally, then we can have a call and I can tell them how that looks.
Amazing. Ed, thank you for sharing your wisdom and thank you for the work that you're doing. I know it's helping a lot of people and has helped many people online and in your practice. So I appreciate you for that.
Thank you for this opportunity. I appreciate it.
All right. Thanks for tuning in, everyone. We'll see you in the next one.